We all know what pain feels like, but what if the pain you're feeling isn't just one thing? What if it's complicated? Today, we are diving into mixed pain, a really common condition that, honestly, is still widely misunderstood. We're going to use a brand new set of clinical guidelines to unpack what it is and, most importantly, how we can start treating it the right way. So, just for a second, I want you to think about this. What if your pain isn't coming from one single source, like when you pull a muscle? What if it's actually this complex storm of different signals, all firing off inside your body at the very same time? That is the absolute core idea we need to get our heads around today. So, here it is, the official definition. Mixed pain is basically when you have different kinds of pain mechanisms happening at once. The two big ones are what's called nociceptive pain. That's your standard pain from an injury or inflammation, and neuropathic pain, which comes from nerve damage. And they're all tangled up in one single condition. You can probably already see why this makes it so tough for doctors to diagnose and even tougher to treat. And let's be clear, the stakes here are incredibly high. The research shows without a doubt that when someone's dealing with mixed pain, their symptoms are almost always more severe. The pain sticks around longer, it messes with their ability to live their life, and yeah, it leads to a much lower quality of life. This isn't some small detail, it's a massive burden on people and on the entire healthcare system. Okay, so to really get why the old ways of treating pain often don't cut it, and why these new ideas are such a game changer, we first have to learn to decode the different signals our bodies are sending. Let's break it down. The easiest way to think about this is to picture your body's pain system like a really advanced fire alarm. Its job is to warn you about danger, right? Well, different kinds of problems are going to set off completely different types of alarms. So here are the two main alarms. Over on the left, you've got nociceptive pain. Think of this as the normal alarm. It's supposed to go off when you have an actual injury, like a cut or a sprain, and it feels like what you'd expect, a dull, aching, or throbbing pain. But then, on the right, you have neuropathic pain. This is the faulty wiring alarm. The problem isn't the tissue, it's the nerves themselves. And the feeling is totally different. We're talking burning, shooting, or even electric shock sensations. But wait, it gets even more complex. There's a third type of pain in the mix, called nociplastic pain. In our fire alarm analogy, this is like the volume knob on the alarm getting cranked all the way up and getting stuck there. There's no new injury, no new fire, but the central nervous system itself has become oversensitive, and it's just amplifying every single pain signal. The key thing to remember is that with mixed pain, a person could be feeling any combination of these three alarms all at once. So you can see how complicated this is. And that leads us to a massive question in pain medicine. Why has it been so incredibly hard to find a treatment that actually works for so many people? And it's a totally fair question, right? I mean, we have anti-inflammatory drugs like ibuprofen for that normal alarm, and we have specific nerve pain drugs like gabapentin for the faulty wiring. So why can't we just pick one and call it a day? Well, the answer is actually pretty simple, but it's also profound. You can't fix a problem that has multiple broken parts with just one single tool. It just doesn't work. When you only treat the inflammation, you're totally ignoring the faulty wiring of the nerve pain. And if you only treat the nerves, that deep, aching throb from the tissue damage is still there. This is exactly why the old approach of just prescribing one drug, what doctors call monotherapy, so often fails for people with mixed pain. So, what's the answer? Well, these new recommendations lay out a whole new playbook for tackling mixed pain. It's all about moving beyond that one-size-fits-all single-pill mindset. It all starts with a much smarter diagnosis. Step one is so basic but so important. You have to actually listen to the patient's story. Step two is using smart screening tools. These are basically simple questionnaires that are designed to pick up on the specific words people use to describe nerve pain, like burning or tingling. And then step three is about being really strategic with tests like MRIs, only using them when you really need to confirm what you've already learned. Now, this quote really gets to the heart of the new playbook, a mechanism-based multimodal framework. Okay, I know, that sounds super technical, but it just boils down to two simple ideas. First, your treatment has to be based on the specific mechanisms of the pain, the inflammation, the faulty wiring, the volume knob. And second, it has to be multimodal. That just means using multiple strategies all at the same time. The first strategy is all about using smart medication combos. Instead of hoping one pill does the trick, clinicians can combine drugs that target different pain pathways. For example, to hit both tissue pain and nerve pain, you might combine an NSAID, like ibuprofen, with a gabapentinoid, which helps calm down those overactive nerves. Or to tackle nerve pain and that volume knob issue, you might use different kinds of medications together. The whole idea is to create a combined effect that's way more powerful than either drug could be on its own. But, and this is a huge but, the modern playbook knows that pills are only one part of the solution. Strategy 2 is just as critical, because pain isn't just a physical thing. A truly multimodal approach treats the whole person. We're talking about things like physical therapy to get you moving again, and cognitive behavioral therapy, which can literally help retrain how your brain processes pain signals. It's all about giving patients a complete toolkit to manage their condition. And the final piece of the puzzle brings it all together: the team. The evidence on this is just overwhelming. When you have doctors, psychologists, physical therapists, pharmacists, and nurses all in communication, all working from the same game plan, the results for patients are so much better. It's not just a nice idea, it's the gold standard for treating complex pain. So, when you put this all together, what does it really mean for the future of pain management? Well, this isn't just some small update. This really is a whole new horizon for how we think about and treat pain. What we're really talking about here is a huge shift in thinking. It's about finally moving away from that one-size-fits-all model and toward care that is truly personalized. It's about recognizing that pain isn't just a sensation. It's an experience that's biological, psychological, and social. This is what holistic, patient-centered medicine really looks like in practice. All right, so let's boil it all down. What are the big ideas to take away? First, remember that pain is often this complex cocktail of different signals. Second, a good diagnosis means looking at the whole person, mind and body. Third, the best treatment is almost never just one pill. It's a smart combination of drug and non-drug therapies. And finally, having a coordinated team isn't just a luxury. It is the absolute gold standard for getting the best results. And that brings us to the final, and maybe the most important question of all. The expert playbook for treating this kind of complex, mixed pain is here. It's clearer than ever. But a playbook is useless if you can't get the players on the field. So the next great challenge is all about access and equity. How do we break down the barriers to make sure that every single patient who needs this kind of comprehensive, life-changing care can actually get it? That's the question we all need to start asking.